It is my pleasure to introduce Brad Ison, who will be talking about disasters and staff trauma, taken on strength. Brad works for Alberta Emergency Management from 2011 to May 2020. In this role, Brad was involved in responding to and recovering from some of Canada's most devastating disasters. These include the 2011 Slave Lake and 2016 Fort McMurray urban interface wildfires, over 20 flood events between 2010 and 2011, and the 2013 Southern Alberta flood that impacted over 30 communities. As a disaster management professional, Brad didn't recognize his stress-related injuries until he was far from the scene of the damage, having taken it back in one piece. He is now using his accredited coaching to help others feel stronger and more resilient. Brad is currently the owner of Hazardscape Management, where he is happy to no longer wade through flooded basements and saturated livestock pastures. Over to you, Brad.
All right, thank you, Andrew, and thanks also to Fraser and Noana for organizing this and having me today. I tend to speak loud, so if it's too loud, turn down your volumes. I can't control my own, sorry. And I will ask at the start, if you want to unmute and keep the background noise down, please do so, because I will ask a couple questions up front, and then I'll have you mute again, and then unmute at the end, just to keep the engagement going. So taking on strength is a term that I came across when I was doing some research around my ancestry. And I came across my great-great-grandfather's World War I military papers, and I found taken on strength stamped on his papers. And this is actually the stamp from his attestation papers. And the reason that taken on strength was used, it was used mainly by the British Commonwealth for when public servants and military personnel would come into the public service as an employee or a soldier. And when they got assigned to a platoon, or when they were assigned to a ministry and they were put on payroll, their papers were stamped taken on strength. And in the military, the main reason for this was the ration and supply depots would use the taken on strength stamp as an indicator on what support the soldier would need in terms of food, blankets, clothing, ammunition. And when they left the military, or they went into hospital because they were wounded, or when they were taken off the payroll, their papers were then stamped struck off strength. And I really like this term, especially for healthcare workers and other public servants, because it's a symbol of how support is needed for us in our jobs, no matter what they are, because it's difficult working in a public health, a public service field. You're trying to appease so many people all the time at a rapid pace. It's just a very difficult job. And I really like the fact that taken on strength speaks to the need for support, or rations, as they said in the military. So with this, I'm just curious to know from the group, and this is where you can unmute if you like, what are you feeling right now in terms of where we are at COVID, in the COVID response? Where are you at in terms of, like I'm not getting a lot of sleep personally, neither is my wife, but what are some words to describe how you're feeling right now?
Hi, Brad, it's Sandy. I'm feeling very confident in our public health system and how they've responded. I'm feeling very confident also in our municipal and provincial governments and the messaging that's coming from the federal government. Here in Alberta, of course, we haven't had the level of impact. The COVID-19 hasn't had the level of impact that it has in other jurisdictions, as we've heard from other presenters. But I'm feeling quite hopeful myself.
Good, thanks, Andy. Anybody else? Just spit out one word if you want. If not, I'll keep going.
Yeah, Brad, we're seeing a lot of interest from hospitals in get back to work strategies. How do they communicate with a world that is surely to change in the post-COVID era? More workers are going to be remote. How do they contain the spread of COVID-19 upon a resurgence? How do they do contact tracing? So these all seem to be top of mind initiatives that we at Everbridge are working with our clients or hospital health system clients on.
Great. So I'll get into my story. Thanks for that. I'll get into my story here. So I'm the former director of training, accreditation, and standards with the Alberta Emergency Management Agency. And I came into that role in 2011 in February to help with the Southern Alberta floods from 2010. And 2 months into my job, the 2011 Slave Lake fires hit. So I was literally placed into the hot seat and spent almost 40 days in our emergency operations center. Then after Slave Lake, very shortly after Slave Lake, we saw another 12 flood events in 2011, mostly down in the southern Alberta area. There was a lot of water left over from 2010. So they were vulnerable to the spring freshet and snowmelt from 2011. The 2013 Southern Alberta floods, I spent another 90 days in the Provincial Operations Center and the High River Emergency Operations Center, helping to plan for the recovery financial assistance that we were going to deploy. I also helped with some of the re-entry planning and some of the emergency social services planning that was going to take place in High River and in Calgary. And spending 90 days in an emergency operations center is not very fun. It's at the beginning, it's a bit of a rush. In the middle, you're doing okay, but you're starting to wonder when it's going to end. And when there's no end in sight, and when you're on your 25th, 30th, 12-hour shift, bouncing between AM and PM, it gets very stressful. And I know for a lot of healthcare workers, especially in hospitals, there's emergency operations centers within hospitals all over the place. And I can only imagine what healthcare workers are going through right now, being in that setting, going into almost, I think, around day 60 of this event. This is a picture, the first picture I took in High River during the 2013 floods. You can see flooding, that's looking north. You can see flooding out into the city. I was spending some time here at the Emergency Operations Center, like I said, getting ready for the delivery of our disaster financial assistance, which we were preparing for on day one of re-entry, 1,800 people to come into their homes. So up in the background there, you can see a yellow circle. I took a picture from that window, and that was my view. So I was literally a little panicky at this point. I was not really sure how we were going to manage the influx of people. Thank goodness we had non-government organizations like St. John's Ambulance, the Red Cross, Samaritan's Purse there to help manage the crowd and the entry and to have water and things like that on supply. But you can see there, the cars were going all the way back off to the left-hand side there. That's how far the vehicles were. And it was also in this area too, there was cars lined up on the highways all the way through here. So a lot of disaster survivors coming back in to view their homes and their businesses for the first time. Through High River, I spent a lot of time within the community working with disaster survivors. This was the typical home. You can see in the window there, there's some sheets of paper, and they indicate the utilities that they don't have. So what the utilities would do is they would drive by the properties. If there was a blue paper in the window, that would signal electricity utilities were not on, or yellow would be for gas and pink would be for a telephone. So it was quite interesting to see how people communicated when they didn't have communication. These are next couple of pictures are just some that I took from people's backyards. This was someone's backyard at a creek that is normally a small creek, but it had expanded off into the right and took out their fence, and it goes way into their property. So you can see that these are the kind of things that people were coming home to, and these were the kind of issues that we were starting to prepare for when the re-entry was starting to happen. This is one lady's backyard. She came into our re-entry center in a panic and asked that I come out to her home with her personally, just to look at the state of her property. And the reason she wanted me to come out there was she lived alone. She didn't have anybody else that was around to help her out, and she just felt the need to have to share this experience with someone, and she just wanted some help on where to start. So that's about 3 inches of river silt that's on top of her lawn. You can see over here, that's her planter box. There's, it's still wet, so you can see how high the water went. And actually on her home, I'm gonna say the water line is just around in this area here, up the wall, came just under the window. During the 2013 floods, my role was to essentially supervise and manage teams of people in the yellow dots there. Those were reception centers that we had. And my daily routine was really around getting up at 4 in the morning, having to drive, get breakfast, get my paperwork ready for the day, drive to the Calgary Disaster Financial Assistance Center, where we had a center set up to process money for survivors. I met the team there. We discussed some policy, discussed some procedures. I made sure the team was okay. And then I would hop around to all of those locations and just make sure that the teams there were supported. So I was not getting back into Calgary to our office until about 7, 8 o'clock at night. Then from there, I would sign some checks, go over the end of the day briefings with the team, to go to my hotel and write a briefing for the Premier's briefing every morning. So on average, my day was 4 a.m., 5 a.m., driving around all day until close to getting to sleep, trying to get to sleep around 11 o'clock, 12 o'clock at night. And the way that I coped with that, I found out after I came down off of the stress, was mainly through having a few drinks at night just to try and calm my nerves and get to sleep, which I found out later was not really the best way to do things. I was lucky enough to get back to our emergency operations center and get back home in August. And that's when I realized that I was not quite myself. I was starting to get really irritable. I was getting irritable with my family. I was getting irritable with my coworkers. I was not able to look at my phone anymore. I would look and scroll through my phone at emails, and I would just get hyper vigilant and stressed out about having to answer another question that I had answered several times to several other people for months and months. So I think what had happened was the stress of coming out of the acute stress environment was starting to wind off of me a little bit, because I came home and I was starting to notice the impact on me physically and mentally. One of the signs that I had of what was later diagnosed as an acute stress disorder was This Ford Explorer was the vehicle that I was driving through all southern Alberta during the floods. And I was driving through town with my family on a day off in Edmonton and became aware of a Ford Explorer that was driving next to us. And I looked over and I had a flashback to being in that truck. And I was still driving in traffic and was running the risk of going through a red light when, you know, suddenly I came out of the flashback, and luckily there was no cars coming through the intersection. But that flashback was one of the symptoms of acute stress disorder, and it's something I'm quite concerned people are going to start experiencing once they come out of emergency operations centers, and once they start coming out of the acute stress that they're experiencing right now on day 60 of being into this pandemic. I think we're going to start to see people having these sensations and having these experiences, which was very surreal to me. The Center for Human Stress is based out of Montreal, and I've worked with them a little bit to use this material for my presentations. I give them feedback on the reaction that people have to this. So if you do have thoughts on it, I'd really appreciate it, because I can give it back to the researchers. And the Center for Studies on Human Stress has developed a model called NUTS. And really, because everybody goes a little nuts sometimes with stress, they've defined 4 areas where you can experience stress. And I'm going to try and relate these to an emergency operations center experience. So the first one is novelty. That is kind of what you would call your good stress. So getting a new puppy, a wedding, maybe, you know, you get a new car, you've got to buy a new car. Feels good. It's a little bit stressful, but it's good. This is very similar to the first, you know, few days with an emergency operations center. Everyone wants to get in there. Everyone wants to help. Everyone wants to respond. So you're feeling good. You got adrenaline going. It's a bit of a novelty, and that's where your stress levels are at in an EOC at the start. Then you come into unpredictability, and unpredictable events cause stress, absolutely. So these would be things that you can't foresee. And so as you move through working in an emergency operations center, you start to get a sense of wondering, when is this going to end? When is the event going to be over? When is my routine going to get back to normal? And that unexpectedness of not sure starts to move from the novelty to a little bit more of a dangerous acute stress. Another type of stress is threat to ego. I experienced this. This is a hard one for me, because I hate it when I'm told that I'm wrong, or I get that critical feedback, but I recognize that that's one of my triggers. And in an emergency operations center, it traditionally is a very command and control, especially when you're in the general emergency management world, because as Dr. Barbera said, you've got a lot of people coming in from military and fire and EMS and law enforcement. And during response, they just want to tell you what to do, get it done. Don't worry about how you do it, just get it done. And not only is that stressful, but when you get feedback that you're not doing it right or you're not doing it fast enough, that threat to your own ego becomes extremely stressful. And the last bit is a loss of sense of control. So when you perceive that you've lost control in something, it gets very stressful. That's why people experience stress at work, maybe because there's a change coming up that they don't feel they can control, or maybe their career is going into a direction where they think that they can't reel it back in and get it to a point that they're developing it where they want to be. So that loss of sense of control happens in the emergency operations center. Again, when you don't know when things are going to end, maybe you've been thrown into the hot seat or another role that you're not trained for. And so that's another area of stress that comes up for people. So something that I worked with my teams a lot on, especially after experiencing the 2013 floods, was I came up with this activity with my team called Preset Your Benefits. And you know, most public servants and a lot of people have health benefits, Blue Cross or Sun Life. And I contributed to like an old radio or a radio today where you've got the preset buttons down on the radio here where you can preset the radio stations you want. And what I encourage people to think about is how can you preset your health benefits? Even if you don't think you're going to need them, you've got them, you pay for them, preset them. And what I mean by this is, for example, maybe you don't ever think you're going to need a psychologist. Well, why not use your benefits to take the time pre-disaster, pre-emergency to find a psychologist, at least have 1 or 2 sessions with them just to give them your background. So if the day comes that you do need them, they're just a phone call away and a quick appointment. Because we know in mental health that the reason people don't get the immediate support they need is because it takes so long to access it. It's getting better with telemedicine and telemental health services. But if you need a psychologist, it can take 4 to 6 weeks to find one, get in with them, and help them get to a point where they understand what's going on for you. Even if you don't think you're ever going to need a massage therapist, you know, find one in your local community, maybe go out, just try and a 30-minute massage. So if you do ever feel that you need one, you've got them accessible. So I talk a lot about to my staff and encourage them to preset their benefits. It's kind of like having an emergency preparedness kit for your home, but this is an emergency preparedness method for your mind and your body. So I want to conclude this with a bit of a coach approach, because right now, everybody I think on this call is likely working with others and their self that they're experiencing stress and anxiety, maybe some sleepless nights. And I just want to give you a couple tools that you to act as reminders for you to use in your toolbox when you're supporting yourself and others. And this is where we can, if you want to go on unmute and throw out a couple more words, I'll record them down. But I'd like to hear from a few people. When you ask yourself this question, how can I support you best right now? When you hear that question, if you were to hear that from a colleague, what kind of answer would you give? And what the reason I throw out this question is, if you're noticing somebody at work who is maybe having trouble, you notice that they may not be themselves, this is the one question, the one tool I want you to have in your toolbox for them. I don't want, you know, I encourage people to not jump in and try and be the problem solver, or I encourage people not to jump in and try and fix things for them. I encourage them to ask this one question, and then I just ask them to listen. And then my horrible writing, listen more. Don't need that S. So if you had a peer or a colleague ask this question, you know, think of a response. Pre-disaster, pre-stress. And then for yourself, you know, ask yourself this question as often as you can. How can I support myself best right now? We're going through a lot on our own, our spouses, our kids, our coworkers, and you've got to take care of yourself. So I challenge you to ask this question to yourself on a daily basis and reflect on a response, whether it's exercise, nutrition, whatever it is, reaching out to a friend, saying thank you for their help. I encourage you to do that. Any quick tips on what people are doing to support themselves best right now that you want to share?
Hi, Brad. It's Lana Lepke-Hickman here. I think one of the biggest things is to have some sort of normalcy to your day, to have get out of bed, get dressed, have a shower, have a routine, work out, drink water, eat healthy, that kind of thing. I think that's a big one, and as far as mental health, for sure.
Great. Thank you, Lana. Appreciate that.
Sean here, Sean Moore in Kenora. One of the things I've done with my group is for our emergency physicians, there's 15 of us in town, and a handful of other practitioners and physician assistants, et cetera. And we're having to meet an awful lot at a lot of terrible times. So in order to meet their people's schedules, every Friday I've been having a work meeting, which sucks, except that I've got the best restaurant in town to cater for the entire family of each of those people, to give everyone a break from cooking and doing and so forth, and have it delivered to their homes. So we're all doing Zoom meetings for, yes, it's in a bad part of time at the end of the week, but providing that meal for everyone and taking it out of our budget from the emergency department, specifically from our own pockets. But it really has done a lot for people feeling normal and feeling like they're in this together.
I love that. Food is the language across all of culture and society. You win hearts with food. That's great. So I mentioned in the chat, and thank you for those contributions, and thank you for spending 25 minutes with me to listen to my story. I know I went through it a bit quick. It's usually a 45-minute presentation, and I get a little bit deeper into some of the other aspects of it. But I know, being the last presenter and doing this online, attention spans are a little bit low during these days. So as I mentioned too, I wanted to give away a couple coaching packages. So the way that this will work is my email is on the screen there, brad.ison@hazardscape.com. I'm going to give away 2 3-hour coaching packages. They're private one-on-one that we'll do via Zoom. They're all confidential. And what I'll do is the first email that I get, just put in the subject line Spark Conferences. The first email I get will win a package, and then I said number 20. Email number 20 will get a package. And if I don't get 20 emails, I'll just pick the last one that I get. So that's my thank you to the healthcare professionals out there who are working hard. You can use the session for whatever you like. And thank you for all that you do. Really appreciate being able to share my experience from Alberta to you. And I'll leave you with one very interesting thing that I've seen through the presentations today is that hospitals, to me, look like a little community. And when I think it was Andrew, one of the speakers, was saying their emergency management department has 9 staff. The city of Edmonton's emergency management department does not even have 9 staff. I think it's got 4 full-time staff augmented by some fire rescue people. And I come from a world where I worked in the Ministry of Municipal Affairs, so we supported municipalities in emergency preparedness. You guys support hospitals like a small community, and I see so many similar connecting things between how a full-scale municipality prepares for disasters and how the health profession does. So I think there's a lot that could be learned if we were to cross-pollinate a little bit more, and that could be a possible area for exploration. So thanks again. You can visit me at hazardscape.com. I'm on Twitter if you want to send a quick message, Instagram if you want to see a little bit more of a personal side of me, and LinkedIn if you want to see the professional side.